I know one of the other stressors that I've heard a lot about from some of our readers is around the COVID vaccine and can they breastfeed with the vaccine? So, do you have any guidance or thoughts on that you can share?
Yeah. So on the personal note, I got vaccinated and I'm still breastfeeding my twins, but I got vaccinated and did not interrupt anything with breastfeeding. Um, yes, it's very frustrating that pregnant and lactating women are excluded from medical trials. And
Right.
the phrase that I really liked was they should not be protected from research, they should be protected through research. And thankfully now, people like myself, thousands of women, we've donated our milk to be tested, and we are starting to get some um, actual evidence on breastfeeding and the COVID vaccine. Um, the most recent that just came out on the 25th of March was it's a preprint. So nothing has been a preprint means it's been accepted by a journal, but it has not been peer reviewed, meaning it hasn't been critically reviewed by experts in the field. So just knowing that this is preprint, pre-knowledge. But it was a study of 131 people, both pregnant and lactating. I think 31 were lactating, and they studied milk and blood levels of pregnancy of the women who were pregnant and breastfeeding, and then they tested the breast milk antibodies, and they found that women in their blood who had been vaccinated, and they compared it to women who had actually just had COVID, they had higher and more robust antibodies in their blood, and then women who had been vaccinated had antibodies in their breast milk. And so there's different types of antibodies. There's 5 different types, but the 2 that they looked at are called IgG and IgA. IgA is what we typically think of as pass-through breast milk, and that is what we call it the mucosal antibody. And so that's what goes in your mouth and around your GI tract. It stays around for a few days to weeks. It's not a permanent antibody. But it's dose dependent. So as long as you keep breastfeeding, you keep having this IgA until you stop, and then the IgA will eventually go away, versus something called IgG, which is our long-term antibody. And that is what we develop whenever we get immunized, whenever we get ill with something. And that is what long-term protects us. So they found both IgA and IgG antibodies in the breast milk of these women. Now, what we don't know is if that even gets into the baby, what happens if it gets degraded, how long it lasts, if it even provides immunity. We don't know what this will do in the children, but we do know that there are SARS-CoV-2 antibodies present in breast milk, which I think is incredibly exciting. Granted, this is all pre-proof, but I think this is incredibly exciting, and provides further evidence of things that we assumed, because women get the Tdap vaccine while they're pregnant, and they get the flu shot while they're pregnant, and they get flu shot while they're breastfeeding, and we see these antibodies present in the child, and present in breast milk, and we've known that, and we've known that these vaccines were safe and protective for the baby, but now we're just seeing that come actually from into evidence, essentially, with the COVID vaccine. So overall, I believe it's safe. I am recommending my pregnant and lactating parents in my practice get the vaccine.